Good afternoon, everyone. My name is Richard Ettl. I'm the co-founder and CEO of SkyCell, and today I would like to share with you how we help to bring medicine from the manufacturing sites in the Western world to 100 countries around the world. And it's a problem of two ways. One, it is actually a problem to transport these temperature-sensitive, life-saving products. If you remember during COVID, you probably all heard stories how temperature sensitive some of these vaccines were. It wasn't just the COVID vaccines that are that temperature sensitive. Modern pharmaceutical products are biologics. And biologics are very different to the previous generation of pharmaceutical products. They used to be chemicals. Some of you may have even produced aspirin in a lab in your high school. That is done within minutes. A modern biopharmaceutical takes 6 to 6 months to make, so 6 weeks to 6 months. So if you lose that pallet, you actually don't have time to make it again. So actually, you're not able to serve these patients. The second part is they're also very expensive to make. And that obviously changes also the dynamics, how much you can lose as a pharma customer. And the second piece is it's a piece of sustainability. Because it's so temperature sensitive and so valuable, it flies. And because it flies, it has a massive CO2 footprint. If you look at big pharma companies today, 92% of their CO2 emissions is in scope 3, the supply chain. 8% is making it. 92% is storage, production, and then delivery. And this is what we're trying to solve. How big is this problem? The biopharmaceutical industry is 200 megatons big annual CO2 emissions, so that's 200 million kilos, 200 million tons, sorry, not kilos, 200 million tons, so that's a massive number. It's roughly half of the UK. And why? Because the equipment is really old. It's either really heavy, so 25% roughly flies in a reusable system from my competitors, or 70% or close to 75% flies in a throwaway solution, so it's even landfilled at the end. And they are very unreliable. Why are they becoming more unreliable? Because the weather has become more extreme. Most of these solutions were designed when the ambient temperatures on airports, for example, was only 30, maybe 32 degrees Celsius. Now we have temperatures 35, 40, 45 degrees Celsius, not in Dubai, but actually in Central Europe and also in the United States or other parts of the world. So actually, weather is impacting massively pharma supply chains. And last but not least, it's a massive amount of landfill that, for example, you're seeing in the picture below here, sort of the backyard of a receiving site that gets these biopharmaceuticals. Well, and then there's also the loss. So today, more than $35 billion worth of pharma is lost every year. Number is growing because the value is growing of these products. Unfortunately, 25% of all vaccines around the world don't work. The pharma industry does recognize which ones don't work, so it's not given to patients and they die, but it's 25% don't work. For example, and that's global average, so it's usually the emerging economies that really drag the numbers to higher, but it's also in the Western countries where it's a significant issue. And this is what we're solving. So we help the pharma industry to eliminate loss in their pharma supply chains and cut 52% of their CO2 emissions. Now, is this a sexy market? Yeah, I think it's pretty sexy. So today, roughly $2.5 billion is spent on pharma packaging. It's growing to roughly $5.5 billion. And the reason for that is more biopharmaceuticals coming to market. We will be able to potentially cure Alzheimer's, but it's a continuous drug that you have to take. It's not a one-off shot. We are able to reduce, through a new diabetes drug, overweight. Very trendy. So these are the products that are really driving volume growth. So where are these problems? One is the technology side, the other one is a process problem. Because you're transporting it from various parts around the world, and it's usually the airport where there's a problem on the receiving side. So 50% of all these so-called temperature excursions, so when it's too warm or too cold, happen when it's at the airport on the receiving side. So what if there was a better way to do this? And so we've decided to develop a solution more than 10 years ago that is transporting from the point of manufacture to the distributor in the various countries. And we have achieved now less than 0.1% audited temperature deviations. That's massively better. Industry average is between 2 and 5%, so that's a 20x better than the next best in class. So how is this helping now on the climate side? We're lighter. And if you're lighter, you emit less on an aircraft. We can also bring more products onto an aircraft. And so, hence, again, less planes have to be booked to fly these products. And it sums up roughly to 50%. We're now a global business. We're operating in 26 locations around the world. This is where most of the pharma is made. So 95% of pharma is made in these locations, from Australia, Singapore, Japan, South Korea, China, India, Dubai, and more than 12 locations in Europe, and now 6 locations already in the US. This only works because we know where things are. And if things don't go according to plan, we can actually intervene. So software has become a key piece of our company, and we're also now starting to give away this software to also other players in the industry. So for example, we're now starting to also monitor other assets that we have built with our platform. So is this confirmed data? So MIT now confirms that actually we save 50% CO2. So very excited that we have one of the best universities in the world. On average, we save on a typical trip from Europe to the United States 4.5 tons of CO2 emissions. Now, if this goes to Singapore, then it's roughly 12 tons, and if it goes to Australia, it's 15 tons saved. So every time a pallet flies, this is the amount we save. Now, what does this mean for a big pharma company? Can they afford this? Well, obviously, they have insane margins, so you would assume they could. So we have one of the big pharma customers in the world. They're saying they want to save 240,000 tons in their supply chain. And if they do this with direct-to-air capture, we're talking about a price tag between 100 and 250 million a year. So that's a number CFOs start to notice, and also shareholders. But if you can already reduce 50% because you use a better technology like us, that's obviously a price tag that makes a big difference for these organizations. So if you want to join the SkyCell journey, we've just raised a round. We've raised 50 million. There's a little bit of room left. Some sort of cornerstones, growing 50% year over year for the past 7 years. We have the majority of the top 20 pharma companies as our customers using it. With some customers, we actually have a 90% share of wallet. We grow when they grow. There is almost no room left with some of those. That market is growing strongly, as we may have seen. And we have almost no competition because it's really difficult to get in. It took us 10 years to get to this level. Most of our competitors are 30, 40 years old or even older. We have very healthy margins. So today the gross margin is almost at 70%. So that's a pretty cool feat. And we're EBITDA positive and focused on continued EBITDA positive growth. So I would love to have you join me on that journey.